We have been in business for 40 years, a little over 40 years now. We started with a single dental chair here in Auburn, California in 1974. We opened our doors. And over the years, we've expanded now to 2 health centers in both Placer and Nevada County. And the first year we served somewhere in the neighborhood of 100 patients. Last year we served somewhere in the neighborhood of 19,000. So it's been a really big 40 years of growth for us.
We have gorgeous facilities, and now because of this remodel, everything is brand new. And it's a wonderful place to work because of that. It's aesthetically gorgeous inside, and we also, I think, are unique in having a full-time gardener who makes the outside of this a very tranquil, wonderful place.
One of the benefits of working for the clinic is that we don't really have a production that we need to meet or necessary production goals. While we do have certain patient volume that we're expected to see and that we're trying to see in order to help fill the need, we're not under the gun of trying to meet certain production goals. And so as an extension of that, I've been able to push myself to do certain procedures. I do a lot more endodontic therapy, a lot more complicated oral surgery procedures that I might not have in private practice.
I really like the people I work with. I think if you're talking about from an optometrist's point of view, the equipment, it's state-of-the-art. I like the fact that the patients really appreciate the patient population that we serve. We're able to provide care to them that they probably wouldn't have elsewhere. They come in and they really appreciate the care that we provide.
Because we're a small agency, we know everybody's family priorities. We know everybody's strengths and weaknesses in their clinical skills. We know everybody's health status. So it's not a giant mill where the practitioners have to show up and fit into, the square peg has to fit in the square hole and the round peg has to fit in the round hole all the time. We get it that your shape of your peg changes over your lifespan. So when I was a mother of 2 little tiny kids, I worked half-time. And then in the last 2 years, I've gone to full-time work because my kids were either off to college or driving.
I can take paid time off, I have paid leave, I have benefits and things that I receive as an employee that if I was in private practice or on my own office, while I could purchase for myself, I would not necessarily have available to me and provided to me. We actually have a significant amount of paid leave that we can accrue and utilize, and that's been great.
We have a very competitive salary now. Our benefits continue to improve. And another important thing is here, we're very much targeting the size of the practice that people have here so that we don't overwork primary care. It's hard work and you can burn out in primary care. So that's one of the keys here is we've tried to pick a certain target for how many patients you have in your panel. And we also target a certain number of patients to see per day, and we stick to that, and that allows us to stay well rested for our patients.
Part of the reason I've had longevity at Chapa-De is because we are dedicated to working 8 to 5 and having the clinicians' days finish as close to 5 as possible. Nobody goes home with a laptop that they have to do 2 more hours of charting on every night, which is the norm right now in medicine. And that's a huge advantage.
I think another rewarding thing is that we have very successful teams. We have a camaraderie, and all of our staff work here because they want to and want to serve this population. They could all work somewhere else, but we have a real esprit de corps because of our mission of what we're trying to do here, and it really binds us all together. We know why we're here, and we know these patients very well, and it's very rewarding.